afternoon, everyone. Taking you guys into the weekend. Okay, so my topic, of course, is connections for diabetes-free. It's community connections, and it's everything community health workers, so get ready. I know we've been talking about them all day, but here we go. My notes. All right. All of my stuff is out of order. I'm sorry, y'all. Okay, diabetes is a significant public health challenge that affects millions of people across the United States. So, of course, here in South Carolina, from what I've seen, it's worse than I've ever seen it. Like I'm not even from South Carolina, but since I moved here, I was like, diabetes is out of control. But it burdens everyone. It burdens your family, your friends, everyone. So today we'll just explore just ways that the community connections can help to reduce the diabetes in South Carolina. Our healthcare system and community programs must unite to tackle diabetes effectively. By integrating community resources and healthcare services, we can create a robust support network for patients. For instance, partnerships with local community centers, schools, faith-based organizations can deliver consistent health education. So, multidisciplinary teams, I know that we just talked about this, but the importance of multidisciplinary care teams is a one-stop shop. Whenever patients can go to one place, that way they don't have, with the transportation barriers, they can go to one place and see a dentist, they can see their PCP all together. You have a social worker, community health worker, and everyone's on standby. Affinity Health Center actually has a dental inside of their organization. So the community health workers actually link the dental and the medical to care, because at times, some patients do go in and like they skip the medical and then go to the dental, find out that their A1C is risky, and then just walk out the door. So the community health workers just bridge that gap and get them back to care. The benefits is just better health outcomes and efficiency. I can go on and on about community health workers. I call them my children of the sun. They go out into the community, they touch everything, they touch everyone. The main thing is just so that patients can have access. I mean, that's just the biggest barrier. So diabetes education can be done in the centers, it can be done in the patient's home, it can be done telework, everything else. They're just bridging that gap so the patients can understand what they're doing. They help the communities. I was just talking about barriers. Some barriers are lack of access to health care, limited literacy, language barriers, socioeconomical factors. They just advocate to get those barriers addressed. And again, I talked about one-stop shop, understanding your resources, having access to those resources. I have a bilingual community health worker, and I have other community health workers, English speaking as well. One hugs the patients with her words. The other one is just like, just chopping the same thing, chopping off the limbs. If you don't get that A1C down, do you want your foot or do you not want it? So that's how they are. So yes, and all together, and I have one that also helps patients to get access to insurance as well. So just one-stop shop. So. Preventative care is important. Utilizing educators and community health workers as a part of the care team before the patient develops the chronic disease can have significant benefits. Prevention, this is how I describe it. It's better to prevent the mess than to mop it up. It costs more money. I know it's not about the money, but it does. Getting yourself back together from diabetes and it's off the charts is easier to manage than just going to your appointments, having your A1Cs checked. the community health workers actually empower themselves to see pre-diabetics versus diabetics. They do see the diabetics, but they see pre-diabetics now. So, public health initiatives, the impact that they have. Public health initiatives play a crucial role in diabetes prevention management, and collaborating with local health departments, community-wide programs can make a significant impact. For example, creating walking trails, promoting healthy eating through farmers markets, and offering free local cost exercise classes. What our community health workers do as well is cluster education, where they will get all of our, it's just a way for the patients to not feel like they're alone in this. So we have cluster education twice a week, one in English and one in Spanish as well. So another thing that the community health workers, and I know it's not on the screen because this slide was supposed to be taken out, but it is here. I wanted to kind of shortly just address the Veggie RX program, the food share. So that is one of the community initiatives that is really big at Affinity Health Center. We get those food share boxes to pre-diabetics, to diabetics. We actually go out into the field, and I'm saying we because I go with them sometimes. We get the boxes for them. We take it to the patient's houses if need be. We've actually rotated time to where the community health workers actually stay later so that those patients that work during the day can still get their boxes every 2 weeks. They've actually started to see results from that. I'm sad that it's ending. Faith-based efforts, it's like I said, my slides are out of order here. I'm so sorry about that. We've been through that today too as well, just having relationships with your local churches, and we actually hold breakfast with the local churches. We do go over to the local churches and do exercises. We actually have a Father's Way, which is a way to help some of the fathers get back into the world, so we address those too. Sorry, again, my slides are out of order. My success story that I have, that is Devondra. That's one of my community health workers. I'm trying to make this fast because of time. But that is Devondra. Oh, I'm sorry. Hold up. That is Devondra. She is one of my community health workers. She had a real life scenario with a patient who actually was struggling. She had bankruptcy. She was going through a divorce. She just, everything that could go wrong in her life went wrong. Devondra actually helped her to create her goals, and she met those goals. She thanked Devondra. That's what her letter to Devondra is. And those are just the things that make the world go round. When those patients feel like they're valued, when they feel like they're heard, those are the things that make them not give up. So that's all I have. I have here that one quote that I have is on March the 27th. It's not even a year, just the date. I have a quote that says, "I am a powerhouse. I am strong. I am indestructible." And that is all of you. You all are in here because you are a powerhouse. You're here to help the patients. You're here to help your coworkers. You're here to help everybody. And so I would just use that power, never give up, and keep the party going. Thank you, guys.